For my map project, I chose to talk about poverty in my community of the Bronx, New York. MAP stands for Mobilizing for Action Through Planning and Partnerships, and it is a community driven strategic planning process for improving community health. The sponsors and stakeholders chosen were people who have the direct and necessary services that can contribute to helping people who live in poverty change their situation for the better. I found services such as free financial counseling, free and low cost education programs, and even free and low cost childcare for people who need to work or search for jobs. Part of this phase includes assessing resources that would be needed for a committee to come together and start the planning process. We could use a meeting space as an area for the committee to come together and brainstorm ideas, some computers to log our information and data for future reference, and possibly some advertisements to get the word out to the community about the services and programs that are and have been developed. My visioning process was very simple. I would like to use the community visioning process because poverty is a wide scale issue in the Bronx, New York, and I would like to get the word out about the various services and sponsors available to help as best as I can. With a large group of community participants, we can have people all over spreading the word, handing out flyers, and volunteering to make the plan as effective as possible. Even if people do not need the services themselves, they might know of someone who does and they can tell them about it. Many people are not aware of the help that they can receive for free to help them escape poverty. I chose these visioning questions because I want to get people to vision a world where poverty doesn't exist and get creative on ways that we can end this disparity for those who are affected. My vision is to create a Bronx where no one has to struggle through life due to poverty stricken conditions ever again. We want to create a community where everyone can afford a decent quality of life and access to services when needed. I value people, and everyone deserves a fighting chance. For the community themes and strengths assessment phase, the assets and strengths that my community has are shelters, food pantries, clothing drives, free or low cost healthcare clinics, which also include Medicaid and Medicare, and rent assistance. The local public health system in my area has a $1.6 billion annual budget and over 6,000 employees that work to protect and promote the health of the 8 million people living in New York City. They have many services that are important to improving the poverty rate in the Bronx, such as unemployment benefits, heat and utility bill assistance, and WIC benefits that provide free food for women and their children. The median household income in 2014 in the Bronx was $34,284. 24.1% of people living in poverty in the Bronx are white, 27.4% of them are black, 26.4% are Asian, and 36.9% are Hispanic. 39.9% of the people living in the Bronx have no degree or high school diploma at all. Three main factors that contribute a great deal to poverty are a lack of jobs, the high cost of living, and a non living wage, meaning the minimum wage is too low. There is one main policy that impacts poverty, and it is the American Recovery and Reinvestment Act put into place by President Obama, which gave a $20 billion increase to the food stamp benefits program and funding to food banks and the WIC program. The act also has a $1.5 billion homeless prevention fund to keep people from losing their homes or helping them find new shelter quickly. The act also increases job training funds and a program to help low income families save on their energy bills and become more energy efficient. These strategic issues were chosen because I felt like they were some of the main reasons why people cannot escape the cycle of poverty. And if they were addressed, it might help lower the poverty rate a great deal and eventually work to end poverty altogether. The order I chose to go with was work on the poor job market first, because without a job, one cannot pay their bills and feed themselves. Next, I wanted to work on the amount people are getting paid at the jobs, because if you have a job but your bills are more than your income, chances are a person will not be able to keep up with paying for everything or be able to save money in the bank. Lastly, people need to be able to afford their housing costs or they will end up on the streets. There's also a list of goals and strategies here for each issue listed.